Hi, I'm Dr. Adar, and I'm a general and colorectal surgeon at Bay Health. I grew up in a family of physicians, and this seemed like a normal thing to do. And soon I realized that this is the best thing that happened to me. I developed a passion. The fact that you're curing, you have sick patients who come and see you, and you're able to treat them, that was the most gratifying part of all this. So yeah, a lot of surgeons in the family, a lot of physicians in the family, and I soon realized I joined medical school to be a surgeon. Somehow I knew that I had to do surgery is what I want to do, and yes, I love every second of it. I love every day of my job. So I've been living in Delaware for 7 years now, and my kids and my wife, they all love it. I do a lot of cancer surgery, and I see a lot of patients with from early cancers to advanced cancers, a lot of different age groups, from as young as, I have operated on patients who are as young as 20s to as old as 90s. It involves not only the patient, the families. You know, you have a young patient who comes to you with colon cancer, and it affects the entire family. So when you see these patients, you talk to them, then you operate on them, and they are cancer-free. You know, there's nothing better than seeing a patient, nothing better than seeing a patient who came to you with cancer, and you had to, a year or 2 or 3 years later down the road, you tell them you're cancer-free. So that is what you get, you know, in colorectal surgery or even general surgery. So that is the most gratifying part of my job. As I said, the relief you see in patients when you tell them that you're cancer-free or surgery was a success, that is amazing. Compassion is very important in what we do. When you talk to patients, we spend time with them before surgery, and I tend to do that a lot. I spend a lot of time with patients and sometimes have them come back once, twice, 3 times so that they understand. So I try to build that relationship with the patients and the family before surgery. I try to educate them about the disease, about the treatment plan, so that we are all on the same page. And I have them come couple of times before we get to say surgery can be huge. This is a big thing in someone's life. You come in, you give them a diagnosis. It's not easy, and that's something which I really you know, I spend a lot of time before surgery. And then when you get to operate on them, you get to see them after surgery. You get to see them multiple times when they follow up. You build relationships. You know, I had my kids play basketball, and one of my patients who's a coach, basketball coach, he's now coaching, and every time he comes and he reminds my kids, your dad saved my life. The response you get from patients, their families, only happens in a small community like this. So I love this place.